Hey everyone, this is Julie, the Cancer Dietitian. I'm back with the 4th episode in our colon cancer series, which is sponsored by the Colon Cancer Coalition. I hope you have enjoyed this series so far. I'm fortunate to have access to so many experts in my local area, and I'm grateful that the Colon Cancer Coalition wanted to support this effort. On today's episode, which is the 4th in our series, we are discussing diagnosis and treatment of colon cancer. For many, the time between diagnosis and the end of active treatment can feel like a whirlwind. I hope this episode sheds some light on how the process works, how to cope with the anxiety of a diagnosis, where to go for help, and how caregivers, friends, and family can help people who are facing a diagnosis of colon cancer. My guests today are a GI Oncology Nurse Navigator who serves as the resource for GI patients from their point of diagnosis through treatment. I also talk with a Board-Certified Medical Oncologist who is also a cancer survivor. In today's interviews, we had some audio difficulties, so you may want to turn your volume up. We'll be back to regular audio in the next episode. I hope you enjoy our talks today. Today, I'm here with Joyce Fenstermaker, who is the GI Oncology Nurse Navigator at Wake Forest Baptist Health Comprehensive Cancer Center. She's been in that position for over 2 years, and prior to that was a cancer center research nurse. So we're grateful that Joyce is here to share her expertise with us. Thanks so much for coming in today.
Thank you for inviting me today.
So today's episode is about treatment, and we're going to talk a little bit about how are people diagnosed and how do they make decisions for their treatment regimen when they have a diagnosis of colon cancer? So I guess we could start with, how is someone diagnosed? Like, what brings them to the point of seeing the cancer center?
So most patients are diagnosed through a colonoscopy. They may have had symptoms that led them to go for a colonoscopy, like rectal bleeding, or other risk factors, maybe a family history.
Okay. And then once they get that diagnosis, so how long does it take? I'm not sure. When do you enter the picture versus when the oncologist or the surgeon enters the picture? What's the order?
Sure. So when a colonoscopy is done and they see something abnormal, they'll biopsy it. And that biopsy is sent to a pathologist, which will put it under a microscope and see if it's cancer or not. And once it's determined to have cancer, then a person is sent to a oncology person who specializes in care of cancer patients. And usually it is a surgeon first, and that at that time, they will have a doctor's appointment with that surgeon, and they'll start the process of understanding their diagnosis and then going into a treatment plan.
So is someone told, like, you get knocked out for your colonoscopy, you have it done. If they had to biopsy something, do you get the results of that biopsy when you wake up, or is that like some kind of follow-up appointment when you get that information?
So a lot of times the person who does the colonoscopy will later call that patient, because there is a time point where the pathologist has to get the specimen, do their prep and stains on that specimen. It takes maybe even up to 7 days to get that back.
Okay. So they would wake up from the colonoscopy, be told, oh, we biopsied 1 or 2 or I don't know, however many.
Correct.
And we'll let you know the results next week or whatever it is.
Correct.
Okay. And then they would have an appointment, be told the not so great news.
Right.
Then they would come in and meet with the surgeon or surgical oncologist or
Correct.
Okay, who would describe what they found out from the biopsy.
Correct. And then they'll go into more depth about what the stage of the cancer, and then they will recommend CAT scans, lab tests, everything to try to get the full picture of the patient's clinical stage.
Okay. So it seems like at this point, then you're kind of on this track of investigating what all you've got going on.
Correct.
You've got biopsies, you've got scans, you've got experts who are helping to make sure that you have all the information that you need to make a good choice about treatment.
Correct.
And so at what point are those treatment decisions made?
So they start when the person first enters the door and sees the surgeon. After that, they may go to expand their treatment options and see a medical oncologist. Depending on the stage of the patient, they will have the treatment plan tailored or individualized to that patient. And it is based on the stage.
Okay. So then an earlier stage, oftentimes it's only requires surgery, and then that's the end of treatment?
Correct. So, for instance, if a person has a very tiny little cancer found in a polyp that was removed during the colonoscopy, that would be an early stage. Mm-hmm. And they may not need surgery. They will need follow-up for life. Mm-hmm. They'll need colonoscopies in a year, maybe after that 3 years. Depends on if they find any polyps, they might do it yearly. If a person has more of a cancer that has spread into the wall of the colon, then that is a higher stage. There are 4 stages for cancer, mm-hmm. and the second and third stage involves more into the wall, and then lymph nodes that surround this tumor in the tissue is more of a stage 3, and then stage 4, it has spread to other organs.
Okay, so possibly someone has a colonoscopy and they have a cancer, it's cut out, that would be a stage 1. Mm-hmm. And then some people, then they have a higher stage, they have to go back for additional surgery. And then if it's a maybe stage 2 or stage 3, it probably requires chemo. And for sure, if it's stage 4, it's going to need additional treatments.
Absolutely.
So how long is the process between, say, the colonoscopy mm-hmm. and the final decision on what the treatment plan is?
Right. Well, of course, the sooner the better. Uh-huh. But in reality, guidelines state that from diagnosis, the colonoscopy say, to when they start treatment should be 60 days or under. It does take a while to get all of the facts together. Mm-hmm. Most people probably do get treated much sooner than the 60 days. For colon cancer, if the decision is to do surgery, then that will be determined at the visits with the surgeons. If a person has more of a lower cancer, meaning it's in the rectal cancer area, then first-line treatment may be a little different. And they may have a treatment plan of what they call neoadjuvant therapy, which is a combination of radiation and chemotherapy, then go to surgery.
Because in that case, it helps to shrink the tumor before surgery, which makes surgery, hopefully, likely more effective at getting everything.
Right, and hopefully reduce the chances of people having a permanent colostomy. Mm-hmm. Some people have to have a temporary colostomy if it's lower down in the bowel. But treatment plans are very important to be discussed right up front. There's no real time now for rushing to surgery. It's more like, let's get this right to begin with. Let's get all the facts. If it's lower in the pelvis, they'll order an MRI so they can really see in detail the location of this tumor. So they definitely can make sure that the treatment is right the first time.
Yeah. I think when I work with patients who come here to cancer services, I think that time frame is sometimes the most difficult time frame because there's something in you that's not healthy, that's not good, that's scary. But then you're waiting around trying to get all the information to make sure that the treatment plan is right. And sometimes it feels like, the medical system is kind of dragging you around because you have to make appointments, and sometimes people don't call you back. And what seems like, a couple hours in a day is such a short period of time when you're facing this kind of issue that it's a crisis, and 3 hours can feel like forever for a doctor's office to call you back just to schedule your next scan that is required before you can ever make a decision.
Absolutely. I would say this is such a stressful time for the people that I see and their family members, knowing though that this tumor probably had been there for a long time. It just doesn't happen overnight. It's been there a long time, and waiting another week or so in the big picture of things doesn't matter.
Yeah.
I mean, it does emotionally.
Right.
And that's the hard part to talk through and to try to cope with.
Yeah.
But knowing that the treatment is so important to get it right the first time.
Yeah, I think
not rushing.
The recommendation that you start treatment within 60 days, I think that's an important thing to keep in mind, whether it helps someone feel better or not. But yeah, the idea that something can grow out of control in a week or two, it doesn't typically happen that way.
No.
And so sometimes I think you can talk yourself down. But then the other piece is that emotional coping, especially during that time, the best thing to do may be like distracting yourself with fun things that you do so that you can bide the time until you get to the point of treatment decisions or a treatment plan, when you can then kind of feel a little bit more or less anxious about things not having a plan. So our episode 6, this is episode 4, but number 6 is on emotional coping, and our experts will talk about ways to deal with that. I know I've been through times of high stress and anxiety where sometimes I just need to watch some kind of show, binge watch a show that, fills up my time and keeps my mind off of something else. Some people, as a dietitian, oncology dietitian, people will come at this point very concerned about what to eat. And so I help them remember that it's not necessarily growing out of control and that they want to get good, solid, evidence-based information, but really remembering that these recommendations for treatment is that it can take a few weeks before you get your plan, and that's really okay.
Exactly. And, cancer treatment has come so far. In our country, we have NCCN Guidelines.
So that's
which
the
are
national
clinical practice guidelines for cancer. And they're specific to each cancer. And they have them for colon cancer. They have them for rectal cancer. And these guidelines change every year because new drugs are made, new research studies have proven better practice guidelines. We are learning so much. It is a exciting time. I think I have seen people with stage 4 disease that are newly diagnosed with stage 4 disease through treatment and surgery with time can become what we call NED, no evidence of disease. And it's exciting because in years past, we didn't have that.
Yeah.
And there's a lot more ways to treat spread of cancer.
It's hard to, when someone's diagnosed, to remember that there are constantly new guidelines. And so it's great to talk to other people who've been there. They've been there, they've done that, they know what you've been through, but also remembering that what they had to go through may not be what you have to go through because it's a different year and different recommendations and new treatments. And so people can look up the current recommendations. NCCN colon and rectal cancer guidelines for patients is a good place to kind of look. Okay. And then for caregivers or friends who are out there listening, I think that just being present with somebody during this period of time and listening to their concerns and inviting them to do fun things can be really helpful, like finding ways to help them keep their mind off of what might be a very anxious period of time. Do you have other pieces of advice for patients or caregivers and friends on how to support somebody through the period of diagnosis and treatment plan, but also through treatment itself?
I do. I think it's important for the patient to go to the doctor with someone else. You only hear part of it. Mm-hmm. You're sitting there saying, how is this going to fit into my life? How can I deal with this? And so if another person is there with you and can actually take notes mm-hmm. all along and say, okay, this is what they said. Occasionally people have taped the discussion and later reviewed it again.
And if you don't know, most or all smartphones have capability of audio recording. And I went with my dad to one of his appointments and asked the doctor, can I record this visit? And the doctor's like, sure. I don't think anyone minds to have that recorded.
And as a nurse navigator, I frequently get calls after an appointment that a person has. And they have questions about what does a certain term mean or what is a plan, what specifics of the plan they didn't understand. So it's nice to have a navigator as a resource to kind of touch base with and discuss things.
Yeah, it's really helpful. So in Winston-Salem, Joyce is the GI navigator for Baptist Hospital, and then Julie Pope is the navigator at Novant, who will be on our emotional coping episode. And so people who are treated here in Winston-Salem have a person, and you should use that person is basically what it is. When you have questions or you get home later, you can call. If someone's at a different treatment center and they don't have nurse navigators, a lot of times it's the nurse the doctor's nurse would be someone you could call back. And we encourage people to make that call, to not feel bad about bothering their medical team. If they have questions about their visit, they should call their contact person and ask those questions because it's important that they understand what's going on.
Correct. And there's a lot of barriers people have normally before they had cancer that impact their treatment and how they can get to treatment, like transportation issues, financial issues. Maybe they have lack of support, lack of people at their home. But in Winston-Salem, we have a lot of resources. And just asking questions and feeling empowered to ask those questions to the treatment team is important.
Yeah. And we have a whole advocate team here at Cancer Services who can help. We don't answer medical questions, so we will encourage you to contact your medical team for that. But in terms of resources or just talking through what's going on and maybe helping them figure out what questions to ask their team, transportation resources, financial assistance, all those things. And this podcast is sponsored by the Colon Cancer Coalition, and we also have a grant to do financial assistance for people with colon cancer going through treatment. And so those things are available, and our advocate team can help. So we really encourage people to give us a call, give your medical team a call. Don't let your questions go unanswered or your concerns go just left alone. You need to speak up so that we can come in and walk alongside you. And then I think, too, your point about if someone not going to appointments alone, we are a very independent society and we kind of pride ourselves on being able to take care of ourselves. But we really encourage people, take someone with you to appointments. It could be your spouse. It might not be your spouse. It might be a child. It might just be a friend of yours who is a healthcare provider who can be there and listen and help answer or ask good questions. And I think for anyone listening who is a caregiver or a friend, if you know somebody who is going to appointments, ask if they're taking somebody with them. And if they're not taking someone with them and you think you would be a good asset to their appointment, offer to go with them so that they just have a note taker or someone who can remind them, oh, you forgot you were going to ask this other question. But I think that's ways people can really support someone, especially at time of diagnosis and when they go to their treatment appointments, to be there with them, because they might need an extra set of ears and eyes and, hands to take notes.
I also encourage people to make a list of their questions, because if you try to remember them, you won't. But if you write them down, and when you're at home and thinking about it, it also helps kind of journal through your treatment. You'll be so proud of yourself when you get finished with your treatment.
Yeah.
But know that, this is serious and that you'll be followed, or should be followed, for your life with a cancer history. And survivorship and going on with life is doable,
Yeah. And we'll have the next episode is actually on survivorship. So we talk about the monitoring and how to, follow up, and also how to look at the future with your sort of new eyes, new perspective. Well, thank you, Joyce, so much for sharing. This is very interesting. I keep learning more and more with every episode, and I appreciate what you do for our community and for coming here and being willing to share your expertise. My next guest is Dr. Eugene Paschold, who I'm very privileged to have here. I've actually known him for my entire career, so this is fun. And he has 40 years of experience practicing as a board-certified oncologist over at Novant Cancer Center here in Winston-Salem. And we are so thankful for you to come on today.
Thanks for having me.
So let's start out, since you have such an amazing array of years of experience. Can you tell us, how have you seen the field of oncology change over your career?
That's a terrific question, Julie. It's been fun to watch. When I started in this business, we had 1.5 million survivors in our country. Today, there are 15 million of us. And specifically with colon cancer, I can remember a time in the middle 90s when all of a sudden, because of new treatments, people that were sick began to get well, and they get out of their bed and they go back to work. And it was like, wow, what's going on here? We are winning. It's painfully slow, but we are winning.
Yeah. And we were talking a little bit earlier about the new statistics around survivorship and positive news about how treatments are proving to be more effective. So I think that's important to keep in mind, especially since this episode is around treatment. For people who are newly diagnosed, it's such a scary time. And any piece of information that can remind you that there's hope for recovery and for long-term survivorship is really important. So I noticed you said the word we as survivors. So part of the reason that it's really awesome to have you on today is because you yourself are actually a colon cancer survivor. Tell us your story of how you were diagnosed, and then we'll talk a little bit about treatment and what that was like as a care provider to now be a care receiver. So how did you find your cancer? How was it diagnosed?
This is a really cool story. And it's a little embarrassing, but I don't mind being embarrassed. It was the summer of 2004, and I was 52. And I knew how important colonoscopies were. I knew that. And I was going to get around to it 2 years late. And sooner or later I would. I really would. And one afternoon I came home, and my wife stuck a card in my pocket that was an appointment and probably saved my life. My first colonoscopy ever was at 52, and I had colon cancer.
Which is total shock, even for somebody who works in the field that knows that it can happen to anybody. And so then what did it look like? We've just talked with Joyce about the process of, treatment decisions. So you found out that there was cancer, and so you met with a local oncologist, a buddy of yours, and then you decided to get a second opinion. How did you go about doing that? I mean, it's relatively easy, is that right, to get a second opinion?
It should be. Really, the big reason that I got a second opinion was take pressure off my buddy that was treating me. And we decided if everybody could agree, it would make everybody feel a little better.
Yeah, which I always encourage people to get second opinions for exactly that reason, because part of it is so that the patient is comfortable with the recommendation, because if you have two great providers who are coming to some kind of consensus around treatment, I think that can just give you more confidence in your treatment plan.
Most of us wouldn't paint the house with just one bid. And it's amazing to me how few people actually get second opinions. I'm worried that they're afraid somebody will get their feelings hurt.
Yes.
Or get angry. And nothing should be further from the truth. And if they do get their feelings hurt or they get angry, you better go get a second opinion.
So there you go. For anyone listening, it's we recommend at least having a discussion about getting a second opinion. And if you feel like your medical team is insulted or offended by that question, then that's probably a sign that you might consider a different team for treatment.
It's no doubt, it's a red flag.
From an oncologist's perspective, it is normal to send people for second opinions, and it is not anything that hurts your feelings. Is that right?
Absolutely not.
So yeah, I think that's a really great thing to do, and it was beneficial to you. So then you guys made your treatment decision, and what all treatments did you have to go through?
Well, first I had to have surgery, which is sort of cornerstone in colon cancer. You hope you can have surgery and get it all out of there. They did. Unfortunately, they found my cancer was in some of my lymph nodes, which makes it a different stage. And way back in 2004, but still today, that raises the probability of thinking about some chemotherapy in a preventative way. My analogy for folks is it says stuff you put on the lawn in March to kill the crabgrass. You don't know if there's crabgrass there, but if there is and you don't put the stuff on there, you'll have crabgrass all summer.
Right.
So we decided to do it. And after I recovered from my surgery, I had 6 months of chemotherapy, and evidently it worked.
Yeah.
That ended in 2005.
So here we are 15 years later. Yeah. So you talked some about the effects that a diagnosis had on your life in general, and as a care provider. So what kind of perspective did you, I guess, gain from becoming a patient?
And I can say this now. Of course, I didn't know about what this would feel like now when I was in the middle of it, but my initial reaction was, wait a minute, this is not something I get. This is something I do. But really, if you think about it, every other male in our country and every third female is going to face a major battle with some kind of cancer in their lifetime. There's just that much of it. But as time has gone on, I realized it was one of the biggest gifts I was ever given. Shock, fear, craziness. I used to think when people came to see us and we told them, this is what you have and this is what we're going to do and we're good at this, they went home and everything was okay. Wrong. It was the Summer Olympics when we were working through all this, and my wife and I went down to the beach to sort of get our game face on. And every time anybody won a medal, guys, girls, Slovakians, Americans, anybody, they'd be up there on the medal stand, and I'd grab my wife and go, oh my God, look, he loves his mother so much. And finally, she had to say, look, get your act together. We're going to win this. But you were a little bit of a crazy person. It's almost like somebody had a gun at your head. Something is threatening your life, and it makes you a little crazy.
Yeah, you're in sort of crisis mode.
Yep.
So you went through that from the patient side. So you actually had to go into your own treatment center where you work and receive treatment. So was it hard to become a care receiver, I guess, from your coworkers, or were you pretty confident and just did what you had to do?
More of the latter and less of the former. Caregivers sometimes have a real hard time letting people take care of them. They do. We all do. I admit that. I was able to admit that. And I just got snuggled up and swallowed up and covered up with the love of the people I've been working for 20 years. So no, I was able to be a patient and not I did not run the show. I did not.
Like, did you work throughout your treatments? Did you take leave?
Good question. And no, at the time, and with most patients today, they can keep doing what they love to do.
Mm-hmm.
I missed one day in the 6 months because I had a horrible food poisoning, but it wasn't the treatment that made me miss it. And I think it's good, especially in that crisis mode you were talking about, to have something to do, have a reason to get out of bed, put your clothes on, and go do something.
Yeah. I was talking before with Joyce about how sometimes, when you're in that crisis or when you're in a period of time where you feel like you don't have any control, sometimes the best thing you can do is just distract yourself. And so I think work can focus your mind on something other than cancer. Binge watching TV shows
Sure, something.
Yeah, just get you through, kind of pass the time until you get to a point where you're more calm and less in crisis, I guess.
And it takes different amounts of time for different people. It took me several months not to be a crazy person.
So what types of things did your friends and family do for you that you found helpful when you were going through crazy person time? I don't know.
That's a great question. And the answer that comes to mind very, very first is they let me be crazy.
Oh, that is a good thing. Yeah.
They let me be crazy. And we told each other I was crazy. And I might be a little snappy. I might be just crazy. And this will go away. And I try to tell all my patients, this will go away. I promise.
Yeah.
Just hang in there.
And so this is episode 4. On episode 6, we talk about emotional coping. And our expert will share some, ways to cope, but also signs as to when someone might need additional assistance from therapy or other resources. And there is a local support group. It wasn't in existence, I don't think, when you were diagnosed, but they meet. And I know several of our patients have benefited just from being around other people who've gone through it.
When you're able to see somebody that has emerged from the battle and been victorious, you go, wait a minute, they can do it. I can do it.
Yeah.
It's enormous. And one of the things I feel an obligation to do is be one of those people.
Yeah.
Survivorship has obligations, I believe.
And Joyce mentioned too, and you also mentioned about the advances and progress we've made in care. And we had a stage 4 survivor who was our guest on episode 2, that even people who have stage 4 disease can see a place where they don't have disease. And also they may be on treatment for long periods of time, but also survive through that. And so I think sometimes realizing the landscape of survivorship is so different now, and that there's so many different types and there's, I guess, no wrong way to be a person facing a diagnosis, that you are who you are, and being able to embrace that, but also have people around you who can support you is key.
Yeah. The right way to cope with a threat like that is the way you cope with it. And yes, some people get stuck. Some people can't escape the fear and they get paralyzed with that. Our center has an absolutely marvelous therapist that was built to do what she does. And most centers do. And again, it's that ask for help.
Yes.
It's okay to let somebody help you.
And your medical team needs to hear what it is that you need, whether it's more information about cancer, more information about your treatments. It might be, people get referred here to cancer services for social support or because they have trouble affording the cost of care. And I always tell people, especially with financial assistance, that it's better that they get to us sooner rather than later, because there are resources, and sometimes the resources that can assist financially won't back pay bills. So if people wait a long time before they speak up and say, yeah, I'm really having trouble with this, sometimes that can have a negative effect. So speaking up to let people know what your needs are is really important too.
And I want everybody to know on this podcast, I was not paid to say this, but partnering up with you guys was one of the best things we ever did. Ever.
So, yeah, we are a local agency. I think a lot of people are familiar with that. But we actually have advocates that are on site at Novant Cancer Center and also at Baptist Cancer Center. And it's been really helpful in making sure that people get the help that they need. I'm grateful, Dr. Paschold, for you coming on today and sharing your story and for the many years of care that you provide and continue to provide for us here in Winston-Salem. Thank you so much for being here.
Thank you so much for listening today. This is episode 4 in our 6-part series on colon cancer, which has been sponsored by a grant from the Colon Cancer Coalition. Check out their website at coloncancercoalition.org. On the next episode, I talk with experts on survivorship care. Be sure to subscribe to the Cancer Dietitian Podcast on your favorite podcast app. Visit cancerdietitian.com and follow me on social media. I'm at Cancer Dietitian on Facebook, Instagram, Twitter, YouTube, and Pinterest. Talk to you later.